Hi, it's Dr. Pavanka. I wanted to talk a little bit about chronic kidney disease in our dogs and cats today. So, our kidneys are really important to how the body functions. They not only help with conserving the water that the body needs instead of just excreting it all out through the urine, but they also help filter out toxins. They help preserve some proteins that could be leaked out through the urine, and they pretty much deal with a lot of the different minerals and electrolytes. Potassium typically is low because the body can't conserve it if there's kidney issues. And then also we need to be really careful about the calcium and the phosphorus because those can start crystallizing things if they're imbalanced, and the kidneys play an important role in that. The other thing that we also don't think about, but you kind of see later in stages of kidney disease, is the kidneys help with erythropoietin, which helps produce red blood cells. So we do see some anemias too once that progresses. Really, without our kidney function, we have issues with more dilute urine, meaning it's more clear. It's not the thick brown, red, or yellow stuff that we see if they're more concentrated or maybe have an infection. But with that, we have very, very clear, dilute urine. These cats and dogs cannot hold fluids. So a lot of times they come in, they're really, really thirsty. They're drinking a lot, peeing a lot. And because they can't really hold on to that fluid, they're still dehydrated despite that. This is also one of the few times we do see hypertension or high blood pressure in our dogs and cats. I've had cats come in and the presenting complaint was that they had a nosebleed, and it turned out when we checked the blood pressure was high, so we checked the kidney values and we were in, I think, 3 out of 4 kidney disease. We do have staging. We use the IRIS staging usually, and there are 4 different grades. There's grade 1 that's kind of mild, so there's grade 2, it's moderate. Grade 3 is where I start seeing the anemias, and 4 is end stage. Really, the kidneys are an amazing organ because we only really need, I think it's like a third of the kidneys function in order to have a normal functioning body. And a lot of our traditional markers for kidneys with our blood work would be our creatinine and BUN, which they tested at 70% damage of the kidneys, whereas our new SDMA, or symmetrical diethylmethyl, is the one that really picks it up if there's 40% damage. And I probably butchered the name. I haven't had to say it in forever. So when we find that your pet does have kidney issues, that's when we start looking at how we can preserve kidney function. So typically this looks like a lower protein diet because, like I said, the kidneys are in charge of holding the proteins in. So proteins do add to the work that the kidneys have to do. So we do lower protein even with our cats that are obligate carnivores. And we try to really focus on the potassium, the phosphorus, and the calcium so that balances correctly. We also need to supplement fluids in a lot of these animals because, like I said, they can't really hold on to it themselves. So a lot of times this looks like at a certain stage giving subcutaneous fluids, which is those fluid boluses under the skin, which kind of make them look a little bit lumpy. But as they use those fluids, they go away and they stay hydrated. So that is a quick crash course in kidneys. Let me know if there's anything else you want me to cover. But that's kind of what we see with chronic kidney disease in our dogs and cats.